We are live. James, Pollen, thank you so much for joining us. You are a physiotherapist, and not just any physiotherapist. You have a master's in physiotherapy. You've also worked in orthopedics, physio research, amputee rehabilitation, brain injuries, and now you're turning your mind to menopause. Why?
Because that's what's coming through clinic. Um, Women, I'm sure, know from experience it's difficult to get listened to. Just trying to access medicine, that could be a whole nother day-long conversation. Um, Lots of my patients struggle to access medication or just understanding symptoms. And I'm seeing a lot of people coming through with, if you take a step back, menopause symptoms, but if you just hone in, it's frozen shoulder, it's chronic Achilles problems, it's generalized joint pain, just little things cropping up time and time again, and it's just been missed generally. So it's important for me to know, as a physio, women make up more than half the population. Everyone's going to go through menopause in some way, shape, or form with some sort of symptoms. I need to know to be able to treat people.
Absolutely, and you're right. When it comes to aching muscles and joints, it's very when people always when we think of menopause, we always think hot flushes, night sweats, those kinds of things, and changes to your periods as being the main symptoms. But
Yeah.
actually, around about 90% of women say that they have muscle or joint problems, and often they're misdiagnosed or told that they've got fibromyalgia, and sort of then left to suffer without much intervention, really. But there's a lot that can be done. So given the fact that actually there is a lot that can be done, shall we, which end of the body would you like to start with? And we're going to be pretty practical here. We're going to start at one end of the body and work either up or down and go through those main areas of, what's gone wrong there and what can help. Which end do you want to start?
Don't mind. Let's start at the top, work our way down.
Okie dokie. Necks or shoulders? What's your preference?
Don't mind.
Oh,
Start with necks, work on the shoulders.
all right.
So necks generally is stiff necks, achy necks. Um, what can be done? Lots of move. Generally, the answer for all of this is going to be movement. I don't like it so much when people say, "Oh, stop moving." Um, what we know in terms of hormones changing is we need to keep active. Some of the things generally bones get a bit weaker. So the more force you put through the bones, the stronger they're going to be. So generally, for every joint, get it moving. Necks particularly get pretty stiff, so keep it moving. There's some really easy, simple exercises, stretches. I tend to request that most people do something like yoga. Morning yoga is fantastic. I'm an early bird. I'm in clinic by 6:30. I'm already doing some yoga before I start in clinic. But I finish early. But get everything moving.
Because that's an interesting. Because a lot of people find that when things do get sore or they stiffen up, they'll actually do less, and it's very
Yes.
hard to make yourself work through pain
Yeah.
or to actually do those kinds of stretches and to get that sort of the effectiveness out of it. I mean, my neck is shocking, so I can basically only turn. I can't even get my head the full way around on, on either side. Um, but is that a sort of common thing you see? I mean, I remember people will be doing things like this and doing things like that and whatever. What are some good stretches and things that are easy for people to
So
do?
I'll always say, start with heat. Get some heat into your neck. Warm it up. Warm the muscles up. I always think of muscles like an elastic band. Warm them up. They're going to stretch for miles. Stick in the freezer. There's not much movement. Warm your muscles up first and keep them warm. And then I don't mind. Um, Different depends on what's coming in through the door in the clinic. Depends on specifically what I go for. But I look at a little bit of posture because generally as we get older, we get a bit more kyphotic, so hunched over. So I want to straighten everyone out, but then get as much movement as you can get going. I don't care what you do. I just want the movement. For me, that's the most important part because when you stop moving, you stiffen up, you get a bit weaker, and you tend to go downhill.
Very true. Frozen shoulders. Now, some people are actually saying that this should be put on the list of menopause symptoms. And even people like, I mean, I'm on HRT, but even I've had a frozen shoulder and it was not fun. Basically, just in case people don't know what happens when you have a frozen shoulder, you can't put your clothes on. You can't get your arm high enough. You can't get it into a coat. You can't do a whole bunch of things that are really sort of, considered normal, really. So what causes the frozen shoulder, and what can be done about it?
Cause a difficult question. We don't fully know. Um, Generally, if your shoulders get stiff and you don't move it, you're more likely to get frozen shoulders. There's a whole host of risk factors. For me, I want shoulders to move. So if you've had any shoulder injuries, so like falls, slip, trips, and falls, get it moving. I'll give people a 48-hour leeway of resting it and icing it, but then I want it moving. As long as there's no specific damage, fractures, follow medical advice. But generally, I want shoulders moving. The more your shoulders move, the less chance that they have to stiffen up and to get a frozen. Um, if you've got a frozen shoulder, take pain relief and try and get it moving.
When
Take
you
what you're given.
trying to get it moving, I remember I did go to the physio for this, and I would probably call her a sadist. She gave me some of the most horrible stretches to do, and they were painful, but they made an incredible amount of difference. And then she also gave me a lot of really quite good sort of strengthening exercises to do, rotator cuff things with weights, sort of like if I'm going this way, you get a weight and you're sort of going through like that. Are they sort of things that are useful? They're sort of really getting the movement going. How would you structure it?
Heat. I still go with heat first off. Warm up all the muscles, the tissues, massage. You can stick your fingers in, massage. You'll get
Well,
partners,
you're
friends.
much nicer than she was.
Start off there, and then dive into stuff like pulleys. Over the edge of the doors, get your arms moving so you can use the other arm to pull down as the other one goes up. To get the arms moving. So even if your muscles are feeling a bit sore upset, you can still get that movement in. So really gentle movements to start with. Sometimes sliding your arms up and down a wall or in front of a table, so you're really forcing that movement, but you're not using your muscles, because sometimes that's quite painful or difficult.
Yes. And that was actually, I remember doing that, and that was really, really painful in itself to actually, because it just seizes up, doesn't it? It just, and the weird thing is, it seems to come out of nowhere, which is why you sort of like, you just kind of wake up thinking, I used to be able to put my clothes on, and now I can't.
Not anymore.
Yeah.
For women, I think the most important thing to know is the movement to get your arm behind your back is one of the last movements to come. So putting bras on is one of the most difficult movements. So just being aware that if you've got a frozen shoulder, don't expect that's going to be the last thing you're going to be able to do. And lots of the time I'll say, look at clothing that you don't need to fasten at the back. So either fasten spin or get front fastening, or like sports bras, so that you don't have to do any fastening. Frozen shoulder can last a couple of months all the way up to a couple of years.
That'd be
And
hell.
there's no way we can tell. There is surgery options that can improve that, but that's not always the case. And if you're menopause and you get recurrent frozen shoulders, you don't really want lots of surgeries.
No, not really. You won't
I've
be.
had quite a few people that go away and they've gone and swimming in hot countries and shoulders are fantastic, and they come back to the UK and they get frozen shoulders again. Keep it warm, or live somewhere hot.
Yeah, moving down from the shoulders. The other thing that I found came hand in hand with the frozen shoulder was tennis elbow in both arms, to the point actually where I couldn't carry my shopping bags home from the supermarket. So that was fun as well. What causes the tennis elbow type sort of situation, and between actually the shoulders and the elbows, how important is it to get the strength back in as well?
So starting from the end, then strength wise, like you said, you can't carry shopping bags without it. Strength, everything I do is strength based, at least for lots of the injuries that are coming through. Tennis elbow side of things, there's increased risk factors as you're getting older. Um, Most of the research says physio, get it moving. We've got exercises that will help with getting it moving, reducing pain. You can wear splints and cuffs. Lots of times the repetitive movements that are causing it. I've had quite a few tennis elbows and carpal tunnels from some women that have taken up since lockdown, taken up knitting, so that constant movement. But I've also got quite a few people that get in both elbows at the same time, but actually it's coming from the neck, and it's a long time of stiff neck, not moving, and actually it's more of a nervy cause. So I'll treat the neck, get your neck moving. If you've got a stiff neck and you've got bilateral, so both of your elbows have got tennis elbow, get your neck going first, make sure it's not your neck, and then work your way down to your elbows. And you can do things simultaneously, working on some exercise, getting some movement going, getting some strength into your wrist. There's been some quite good research in the past. So grip strength is a good decider on how you're going to manage later in life. So working on strengthening your hands.
Yeah, you mentioned the neck there being involved in the tennis elbow. Could it also have a role in the frozen shoulder as well? Does it?
Yeah.
Is the neck the root of all evil?
Yeah, maybe. I tend to look centrally first. So frozen shoulders could be a frozen shoulder, but frozen shoulder symptoms can also mimic other things. You've got a really tight, stiff neck, and you're holding yourself up there. You've not got that movement because you're really stiff. So relaxing everything first, trying to loosen things up, loosen up the muscles to start with, and then see is it frozen shoulder or is it something else.
Yeah. Wrists and carpal tunnel syndrome and things like that. I mean, it seems that basically the older we get, the anything that has a bunch of tendons around it seems to get a little bit unhappy. And and as I understand it, estrogen also has an effect on tendons and ligaments, not just muscles and bones.
Yeah.
What happens in people's wrists? And you mentioned the carpal tunnel there and the repetitive strains. Are there ways of avoiding that and fixing it when you've got it?
Yes and no. So everyone is. Some women are born with slightly smaller wrists. The smaller your wrists are, the smaller all the carpal tunnels, the holes that the nerves and muscles and everything, blood vessels going through. So mine are huge because I've got big hands, big wrists. My wife's got tiny wrists. Hers are going to be smaller, so she's more at risk of getting carpal tunnel. Lots of lots of women typing. I get lots of this of repetitive movements, and especially in weird positions. So rather than I promote a good setup working at a good desk, yours looks like a nice desk rather than on a couch, crumpled up in a corner, weird positions, and to be on that in that position for hours on end. So it's looking after your general health, making sure you're making good decisions generally, and stretching. If you do anything with your hands regularly, some sort of stretching. I'm a physio. I use my hands all the time. I'm constantly stretching, weird and wonderful positions because everything gets tight and stiff.
Yeah. Is
And
it worth a lot of people doing the because this is the opening up of the chest and all of those sorts of things, like getting a rolled up towel and sort of lying across it or things like that to sort of open up, because we often we'll often stretch this way or whatever, but we very rarely stretch the front.
Yes, stretching the opposite way. We spend our lives, I mean, everyone here watching on their phones or on their laptops, you hunch forwards. Everything that we do in our lives is forwards. We very rarely open everything up. So I'll always encourage opening up. Don't mind how you do it. But yeah, stretching out. I really like child's pose yoga. And then rolling from side to side, and then just lying on your back. Just lie on your back with your arms out. 10 minutes on your back, stretch everything out.
Yes, I remember somebody actually once they telling me that if you're lying on your back, you should be able to get your elbows flat. Is there any truth in that, or is that sort of because not? I remember making my sister do it, and it was like this.
Yeah.
No woman.
Yeah, and so part of that is to do with posture, part of that is to do with your back, the movement in the top of your spine, so your thoracic spine and your neck. Yes, I want that movement. I want you to be able to get all the way back, lie backwards. Or the other one I'll do is get people to stand with their heels, bum, and shoulders against the wall. Get the very back of the head against the wall. Retract the head, and then get your arms up above your head and get your arms flat against the wall. That's normally quite difficult, because anywhere from 25, when you're spending your life hunched over, we want to open everything up, but it gets stiff.
The other, I mean, we often do everything we do with our hands, and we're just going back to the wrist for a section. We're doing a lot with these muscles, but we're not ever doing much in the way of extension. We're sort of bringing everything into a sort of flexion, aren't we? How can we sort of get that extension in?
So stretching, get you the extensions, so stretching wrist forward and wrist backwards, lifting weights, um, lifting your shopping bags rather than having your arms palms facing up. Have your palms facing down. You'll work on holding that stretch, building up the strength in there. But actually, it's not just up and down. Our wrists can do a lot. So pronation, supination. So sometimes exercises for wrists or elbows will look at pronation, supination. I like using a hammer. The longer the hammer, the more difficult. Literally just on the table, that movement will help to build up strength in the wrist.
That's very true. Actually, I was just thinking of a very long period of time when I had the elbow tendon, so in the gym with the weights just going like this. And I'm sure people
Yeah.
were looking at me and thinking, what is wrong with that woman? Why is she standing there doing that silly exercise? But you know, it made a difference. Backs. Okay, then we get to people's lower backs and the whole thing just gets really ugly. Why do we have so many problems in our lower backs, and why do they get worse as we get older?
A whole host of things. What you do, what you don't do. Um, at the moment, I'm seeing more people with backs because we're spending so much time sat down, hunched over computers, hunched over in the car, just not moving our backs. So I'd want better posture generally, but I want more movement as well. So I think the old way of looking at backs, um, tentatively, yeah, one of the ways of looking at backs is we need to be a bit more protective and careful how we bend. Um, I treat people a bit more, yes, initially when you've got back pain, be careful how you bend, but build up the strength because in life, and even when you've done all the manual handling training, you don't bend how you're told to bend. You bend how you want. You bend in weird positions. If your back's not used to bending like that, it's going to hurt and it's going to get irritated, and then you get problems. But if you train it up, if you build the strength up, build up some core strength, then you can move how you want. The stronger your back is, just like your legs. If you're struggling with your legs and you can't stand up and sit down from a chair, you work on the strength, then you can, and you don't have pain. The same for your back.
See, we say when people say strengthen your back, I mean, what are good exercises for that? Because I mean, it's really important because slip discs and osteoarthritis and osteoporosis, especially for avoiding fragility fractures and all of those sorts of things. So what are good things for building up the muscles in the spine to support the spine, and that are actually achievable for people? Are we having to do deadlifts? Are we having to get into a gym and do that I don't even know what this thing is called. The one when you sort of, it's on an angle and you lie on top of it and you,
Yeah, back extensions.
yeah,
Yeah,
called that one.
all of the above. They are fantastic. When you get to that level, yeah, brilliant exercises, really good for strengthening things up. But you don't start there. I would
Yeah, so
start
where do you start? Because I mean, a lot of people would.
yoga, Pilates, like very simple exercises. So lying on your front, do the Superman pose. You try and lift your arms off the floor. Um, anything when your muscles are activated as soon as you sit up. So if you're sitting up and you're maintaining balance, your muscles are working a little bit. The more you slouch, the less they're working. The more you're upright, the more they're working. When you stand up, all the muscles engage a bit more because you have to maintain balance. So I'll always start with some sort of either Pilates-based or yoga-based exercise, or if there's a class they're already doing, just focusing on some movements for your back to strengthen up your back, and a balance. Balance gets worse as we get older generally, and some balance I've seen has been shocking. I'm 30. People younger than me, balance been awful. Anyone I treat, I want 2 minutes on one leg balancing. Um, that for me is that's my minimum up to the age of 80. Um,
Oh,
and
you're a hard taskmaster. Up to the age of 80, 2 minutes.
but actually looking at preventing falls, when you're walking, you're spending a few seconds on each leg without anything else. The more you can balance, the less chance of injuries. As we know, with menopause, bone gets more fragile, so osteopenia, osteoporosis. So the better our balance is, the less risk of falling, the less risk of falling, the less risk of injury.
Yeah,
And I work on balance from the age, well, most people that come in, I work on from 20 plus just to get the bare minimum.
yeah,
But in terms of back strength, I'm happy with whatever you do. If at the moment you're not doing much, I don't mind. If all you're doing is sitting on a couch and you get up and you stand and balance for 2 minutes, I'm happy with that as an exercise. I will always push more. And if you want to be in the gym, or you want to be deadlifting, you want to be lifting, I'm going to encourage it. We'll get there safely, but I want to push as much as you can do.
And to start that off safely, is it a good idea for people to sort of, if they've got zero balance, because this is really important. I know that people think that fragility fractures only affect really old people, but a study out of Australia recently showed that 50% of fragility fractures happened in women around the age of 50, and that's really young. And when we're talking about a fragility fracture, we're talking about a hip breaking or a serious a wrist or something like that from a standing position. So we're not talking about 50-year-old women falling off 3-meter ladders. We're talking about people standing and falling over and breaking a hip.
Yeah.
That's pretty scary stuff at the age of 50. So something that definitely needs to be avoided. Anita here from Totally Derma says that she brushes her teeth with her eyes closed. Or she's asking, should she brush them with her eyes closed? Because balance is even harder when your eyes are shut, aren't they?
Yes. So either brushing teeth, as long as your balance is good enough that you're not going to fall over and jam the toothbrush down your mouth. Don't want any injuries, but yes, either closing your eyes or really quickly looking over each shoulder, looking up and down. It throws the inner ear and how we balance, throws everything off. So taking away some sensors. Yeah.
Yeah. I can't remember, on Tuesday night I was doing one of these as well with a very, very lovely person. We were talking about it, and she says she's an exercise physiologist, and she was saying I think she may rival you in cruelty, but not in terms of length of time. So she says that she gets people to do these balance exercises, standing on one leg, reciting times tables, while also throwing a tennis ball or something up and down and catching it. So she's sort of making people do sort of multiple movements while you're cruelly throwing in an extra couple of minutes. So so to do it safely, basically sort of start off and you just sort of work yourself up, on sort of both legs.
Yeah, so on 2 legs wide apart, and then bring your feet together. So you're standing with feet as close as you can, and then you can do kind of semi-tandem, which is one foot in front of the other, but slightly off to the side, as though you're going to take a step. And then you can do fully tandem, like you're walking on a tightrope. And then you can do one leg, and that tends to be how I increase it. But making sure you can do it on both legs. So do it on one leg and then the other. And then balancing, and sometimes I'll throw it depends on how people improve, but I'll throw in feet together, then close your eyes with your feet together and work slow, really, really gradually, slowly work it up to one leg with your eyes closed. And if people are fantastic about that, then we'll go on to more like balance boards and those spiky hedgehoggy cushion things, changing where you're balancing, and then throwing a bit more into getting some movements going while you balance. So single legs, sit to stand, squats, really pushing the balance.
Yeah. The other thing that happens then around that sort of part of the body is hip pain. What causes us to have that pain that goes down into the hips?
Estrogen.
Right. Or lack of.
Changing hormones. Most of this is going to be changing hormones. So as our hormones change, um, everything changes. Collagen, muscles, ligaments. It's affected massively. So most of the time, it will be collagen. No, it'll be estrogen changing all the hormones, which affects pain and affects how everything's moving. Some of that will be coming from your back. Some of it will be coming from your hips. Some of it will be coming because you're moving slightly differently. You're stiffened up a bit, so you can be walking differently. It may be a bit of a limp because you've got some pain somewhere else. It's either kind of that generalized joint pain that we're getting in different areas, and it's just painful and it's stiff, or it's coming from a different area.
It's a tough one because
Yeah.
there are these two tighten up. I mean, I guess we get a lot of people complain of sciatica. They've got, piriformis syndrome. They've got, basically they've got pain in their bums. They've got pain coming down the back of their legs. They've got pain coming in through the hip. There are various, it just seems like a never endless sort of cascade of pain coming from your back and coming from a combination of sort of muscles that are too tight and discs and nerves, and it's just a mess down there.
Yeah, it can be really frustrating and demoralizing. You fix one thing and something else crops up, and something else crops up. difficult. Um, what I normally do is go through a list and an exhaustive list with my patients. Um, we're covering every single possible symptom of menopause formally in the criteria and not. So including stuff like throat and shoulders. Um, anything that's I know is linked, even if it's not linked in terms of what will be on the diagnosis. Um, Making a list of what you've got at the moment, when it started. I've got a lovely, I don't know how to share things on here, but I've got a lovely picture of um, all of those things wrapped around, and I'll give it to them and say, circle what you've got, and we'll, if you want to talk about medication, you want to talk about medical treatment options, um, I'll ping an email to your GP and say, look, I'm seeing you for X, Y, and Z. I think it's menopause related. Please have a conversation about medication if that's the route that you want to go down. Um, and very much because I think your last Menopausing 101 was fantastic in terms of prescriptions for um, menopause and medication side of things. That was really informative. Um, from a physio point of view, I need to know what the symptoms are and to be able to have that conversation because lots of my patients have no idea that it's menopause. So it's more just that education. These are the symptoms that you've got. This most of the time means menopause. Having that conversation, what that actually means, that it's it's normal. It's nothing to be worried about. Um, we can work on pain. Physio is really good at working on pain.
Yeah.
Um,
Because even the HRT is only going to go, a certain way.
yeah,
Not everybody wants to take it. B, not everybody needs to take it. C, it doesn't. It's not a magic pill that's going to take all
no,
of these things away. Because I mean, as I said before, I've been on HRT for years, and I still had the elbows and the shoulders and my
yeah,
knees and stuffed, and God only knows what else. So it's not like it's a magic bullet that's going to stop all of these
no,
things. But a lot of people do find that when they start HRT, that their muscle pain and their joint pain does, to a certain extent, become
yeah.
relieved, which is so I mean, I guess it really depends in the end on what the causes of your muscle pain and things are.
And if what we do know is if you go into menopause with joint pain, muscle pain, back pain, it's more likely to get worse. So I always say preemptively, I've got a lot of 40 to 45-year-olds who've got no symptoms, but I'll say, let's talk about menopause now. Let's have that conversation so you know what's to come, and then let's try and fix the problems now so we can get into good
Exactly.
habits, especially sleep hygiene, um, getting good sleep because things get worse with menopause, and sleep's really important for healing. So if you're not sleeping well, you're not going to be healing well. So it's that vicious cycle of being in pain, not being able to do much about it, not sleeping well, then you're tired and grumpy with pain and menopause symptoms. So I start early.
Yeah, and there's just nothing worse than waking up in the middle of the night in pain, really, and not being able
Yeah.
to sleep. That is not a lot of fun. The Just going back to the hips and the back for a minute. I mean, it's just the other things. I mean, apart from the cascade of incredible neural issues, there are so many things that pull on your hips. I mean, to actually even get that balance right, you've got your abdominal muscles, you've got your spinal muscles, you've got your quads, you've got everything there is sort of like pulling and pushing this sort of triangle of bone around. Um, the importance then of keeping movement and keeping them unstiff, I'm guessing, I mean, getting a sort of a balance and unstiffness. How do you do that when you've got everything pulling in different directions and stiffening up?
Uh, Personally, we work on heat. Heat's my number one. Get it warm. Warm things up. Nice hot bath. Nice hot shower. And then after that, I don't mind what works for you. So I will look at everything from Pilates, yoga, all the way up to the gym, deadlifting, Olympic weightlifting. I don't mind what works for you. Finding that, and from a physio point of view, I find what works for my patients. What you want to do, what you want to be able to achieve. Is it just if you want to walk, then we'll work on getting the movements right for walking. If you want to get back to running, if you want to do marathons, fine, we'll work on that. Um, it's very much focusing on what you want to achieve because it's not going to be the same for everybody.
No.
Um, but I want movement and regular movement. So not long sitting, getting things moving. Even if you need to just be able to walk to the bus, then we'll look a bit more about If you feel like you've got some tightness, some stiffness, we'll work on flexibility. We'll stretch things out. It's generally lots of movement. And one of the main things with menopause is it comes either around or just before retirement. What we know about retirement is lots of people, when you're working 9 to 5, or what people normally work, is you've got that routine, you've got a sleep schedule, you've got a work schedule, you're up and about. Even if you've got more of a sitting down sedentary job, you still got up, you get ready for work and go. As people tend to retire, I'm seeing a lot more people since COVID, especially, doing a lot more sitting. So we're not moving as much. You lose that routine. You get those bad sleep habits, and then you hit menopause, and then everything goes out the window, and is a lot worse. Um, so it's trying to get good habits and stick to good habits once you're retired.
Yeah. Yeah, it's a difficult one. And even things you mentioned, them keeping things moving and things, and in the morning, you get out of bed and you got to put your socks on and you can
Aches and
barely reach
pains.
your toes. Yeah, it's like kind of like, what
Yeah.
happened there? Yeah, it's a difficult one. So I guess you're right when you say the morning yoga would be a nice thing. I'm never going to do it, but I'm sure that others who enjoy it would get the benefit out of it. Yes, getting into good habits is a very important thing, because the next thing coming down from hips, of course, are knees. And a lot of people find that they're ending up having, who was somebody was who just had a double knee replacement was telling me the other day, and just I almost ended up having a knee replacement, because this is all about me, darling. It's all about me. But using myself as an example is generally, and this is another thing that is really important about it, is fascia. I had no idea. Now, when I went through university doing anatomy and physiology, fascia was just regarded as the sort of the like, if you've got a bit of chicken skin and you pull it off, you've got the thing that sort of the clear wrapping around a muscle, and basically it was considered to be inert and sort of virtually did nothing. And so I remember when people started rolling on those sort of like little balls in the gym and saying they were loosening off their fascia, and I was sort of looking at them going, oh, for God's sake, really? Come on. And then what happened to me was my knee got worse and worse and worse, and everybody was telling me, every time I go to the physio, they say, "Is your quads? Load it, put more and more weight on your quads, load it and load it." So I was loading and loading and loading, and it got worse and worse and worse. And eventually I went to another physio, and he sent me off for an MRI, and he said, "I think we're going to be heading for surgery here." And then everything came back clear, and he looked at it and said, "I think it might be the fascia." And so he made me start rolling on those horrible little things and giving me massaging me. I swear to you, I don't think that I've ever sworn so much at anybody in my entire life. It was truly blue language. Luckily, he's a New Zealander, and he's got lots of. He's quite used to women swearing at him. But it was excruciating. But it made all the difference. It actually
Yeah.
fixed it. So it's a very, very, everything it's all intertwined, isn't it? And it's not
Yeah.
necessarily just one thing, and it's you
No.
can end up really going off down a wrong path. So tell me about knees, fascia, and quad strength.
Core strength is important. Irrespective of what else going on, I want standing up and sitting down from a chair 30 times. That should be easy, without using your arms. That's my bog standard for everybody. If you're normally under 60, I'm looking to do it on one leg, working on the strength and the balance in one leg.
I am so not going to you as my physio. Did you just say 30 times on one leg?
Yeah, but
Up and
anyone
down
that's
off a
doing sport, up and down from a chair where
Okay.
your hips and knees at 90, anyone that's doing sport, which is most people at the moment, um, under the age of 55, 60. That's what I'm looking for, and that's what we work up to. Core strength, you need balance, strength, walking, anything you want to do up and downstairs, you need your quads. Um, Fascia, yes, tight, gets painful, loosen off, massage, heat massage around your joints. Um, I'll always stick to hands-on massage rather than massage guns. I've seen too many injuries of massage guns near a joint, and you bruise the bones and cause problems. I'll say guns, stick to big muscles, hands around the joints and spine and neck. But yeah, loosen things off. If things get tight, massage across the fibers. So if your fibers go up and down, you want to massage across, loosening up the fascia, and that's anywhere in your body. Um, loosen up your knees, strengthen your knees. So quads, yeah, but loosening off everything as well. So I want some quad strengthening, but I want some quad stretching as well. Same with hamstrings, and then same with your calf muscles. So some of the calf muscles go it through into your knee, so loosening everything off.
Yeah.
And foam
It,
rollering is fantastic because it does lots of that massage and that loosening off the fascia.
God, it was painful in the beginning. It was hell. And now, actually, I notice that if I haven't done it for a while and the knee starts to go, I go back in there, and then again, it's like it's gone like an elastic band just back onto
Yeah,
itself. And there's I'm sure, again, like this in the gym, and there people have thought I'm crazy when I'm go back in there and it hurts, and I'm swearing my head off at it, because it really does hurt. It's
yeah,
incredibly painful, but it makes a huge difference.
yeah,
Who knew? That was one of the things where you actually think things do change and you do learn as you go on.
yeah.
I'm
I
going to
think
have a
that's the other thing is some people get the best results just from working in quads and just up and up and up in it. So it's very much there's not a one size fits all for anything that we're treating. Um, we'll go down one rabbit hole. If it doesn't work, we're going to swap. Just like any physio is going to try different treatments, any doctor will try different treatments for pain. Um, we're going to try and see what works. And if you come into, if you're seeing me in clinic and you say, oh, this really works for me, can we do this? I'm going to say yes. Well, I'll have a look at the problem and go through, make sure I'm treating what the problem is rather than just treating something for the sake of it. But if you know what works, tell your healthcare professional what works, and we'll do it. 9 times out of 10, we'll do it. And if we're not going to do it, we'll give you a good reason as to why not.
well,
But
you
yeah,
would hope so. Yes. Yes,
you're the
exactly.
expert in your body. We might be experts in bodies generally, and we might know the science behind stuff, but you're the expert. I want to listen to you about your pain. I've not experienced how you experience it, so it's very much listening to you. And from a physio point of view, and I do regularly, but it's listen to what you have to say. Listen to how you're saying it. Listen to what you focus on. Because I might think quad strength is the most important thing in the world. You might be saying, yeah, but my shoulder really hurts and I can't carry my shopping. It doesn't matter how awful your knee is. We might do a little bit of knee stuff, but you care about your shoulder. So that's what I need to focus on. So explain your symptoms to your healthcare professional when getting
Yeah.
treatment.
Yes, it's a especially when there are multiple ones. And as we head down the body, then we get to ankles. So what happens to women's ankles? What are you seeing when they come in talking about their ankle pain?
Lots of recurrent or chronic Achilles tendonitis and tendinopathies. And I've got a lot of women at the moment that it's been going on for years and they've gone down the surgery route because it's just not going away. Um, and some of them have had HRT. Lots of them hadn't even thought about it being a menopause symptom. Um, so it's a new way of looking at things. So we've been trying, lots of women have tried the HRT side of things, the medication side of things, but made a world of difference. And I don't see them anymore because I could treat them their ankles till the cows come home. But if it's a hormone thing, I can't change your hormones. Um, and it's looking at A, do you want medication? B, is that right for you? C, exercise wise, movement wise, are you doing anything that's going to irritate your ankles more? And can we change how you're doing it? And ankles is the same as feet, and it's we need to look at everything. How you're walking, are you walking enough? Are you doing too much sitting? Are you got inappropriate shoes, too tight, too loose? There's a whole host of things down at your feet. Um, for me, I think the most important thing is actually washing your feet enough, drying your feet. So I've seen lots of foot infections, especially as people get older, because you get stiffen up and you don't get down there and you don't see your feet. So I've prescribed a mirror and I've said I want you to wash your feet every day, dry your feet, and for people that needed it, talcum powder or moisturize or depending on what the problem is, but have a look at your feet. Um, Especially as we're a population living longer, there's been more diabetes diagnosis, and healthy lifestyles and food and everything. There's diabetes more prominent. Check your extremities more. Get yourself a mirror and look between your toes, um, because I'm seeing lots of problems in clinic, and it's easy to treat
Mm.
when you catch it early on.
Yeah.
But so foot health, generalized foot health, checking your shoes. If your shoes are worn out, I'll look at if someone's come in with hip pain or knee pain or even back pain. One of the first things I do is look at their shoes, get them take the shoes off and have a look. Most of the time, the sole of the shoe comes in wonky because they're walking differently. And we just have a little play around with how you're walking, maybe some insoles or some foot exercises to strengthen up different parts of the feet, to get your ankles moving. Lots of stretching for the calves because calves get pretty stiff. Lots of heat, gentle massage, loosen things off.
Yeah. The speaking of sore feet, one of the things that women often complain of is plantar fasciitis, or sort of the burning feeling under
Yeah,
the foot, that keeps people awake at night.
yeah.
What's going on there and what can help?
What's going on? Lots of times inflammation or irritation in the plantar fascia. So the underneath your foot, you've got fascia, uh, like you talked about, chicken skin, underneath that holds everything in place and circles around. Um, what causes it? Loads of things. Um, Menopause is estrogen hormone changes, collagen, elasticity of all the tissues, um, changing the tissues as well. So treatment for it is everything and anything that works. I've got people that roll frozen oranges under the feet, and that helps. I've got people that roll hot water bottles under the feet, and that helps. Um, People that stretching calves, loosening off the calves makes a big difference. Hands-on and massaging and stretching your feet, stretching your toes. So bring your toes backwards into extension to stretch all the muscles underneath. Um, Depending on where your pain is, um, changing shoes. I've got one lady that's really struggling with her feet at the moment, and I've said wear Crocs. She's got really, really flat shoes, and she's moved to Crocs, and they're fantastic. I'm not sponsored by Crocs or anything, but they've been fantastic for some of my patients. They're nice and squishy. You can walk wherever you want in them, um, and they've been wonderful. Wonderful. Just change your shoes. If you're getting pain and you've tried everything else. If you're not trying changing your shoes, try. Give them a bit of a heel. Give yourself one of them squishy heel gel insoles. So you've got that cushion. I normally say to people with foot problems, I want you to feel like you're walking on clouds. I've got some fantastic shoes that I wear for work. I only wear them at work and they feel amazing. And I'll
A lot
stick
of
the
people
insoles
actually
in.
get a bit of filler into their heels in the end, because
Yeah,
you lose that sort of that little spongy bursa in there, don't you? It sort of
yeah,
it sort of comes in, and
yeah,
then you feel like you're walking on bone all the time.
yeah. So walk on clouds is what I say. Find some shoes that make you feel like you're walking on clouds. There's not this perfect, fantastic shoe that's going to be out there. It's find what works for you.
And the worst thing is when you do find your perfect, fantastic shoe, which I shall now. I love this. I've lived in these, and that I'm not sponsored by. I prefer to say Adidas, but I think that's Nike. So there you go. But these are the best shoes I have ever had, and you cannot buy them now. I have to scour the internet and try and find them on some like dodgy site in the middle of nowhere. They weigh nothing, and they're just so spongy on the inside. They're amazing. I love them, but I can't
If you
get them.
find shoes that fit and that feel nice, buy loads of them. Buy a few
Yes.
pairs of them just for that reason.
Yep, exactly. Stack them in the cupboard until you need them again. I saw a woman on a train wearing a new pair a little while back, and I sort of raised up and said, "Where did you get them from?" because I thought, my God, they must be on sale again, new, because she's got a new pair. But she'd done exactly that. She'd bought a few pairs and shoved them in the cupboard, and was on to the next lot. So there you go. She was smarter than I was. And who wouldn't be? Have we? I think one of the most important things that you said there a little while back was not being able to reach or see your own feet. And mobility really is a key to a lot of this, isn't it? So if you've got to that point where you can't actually see your own foot, or you can't check your own vulva, which I'll just throw that in for something entirely different for you, um, is life over, or can you get that mobility back?
Of course not. Life's never over. I've got people. I've got a 92-year-old. We're working on movement and flexibility. That's we're still improving. Life's never over, um, until it is. Um, in terms of flexibility, movements, yes, it can always improve. My first thing is what can you do, and then what do you want to be able to do. If you want to be able to touch your toes, work on touching your toes. Bend down, get as far as you can, and work on that every day. If that's your goal, is just be able to touch your toes, work on it. The more you work on flexibility, the better it's going to be. If you try and touch your toes once a year and you can't do it and you give up, you try it next year, it's not going to improve. But if you do it every day, 2, 3, 4 times a day, you're more likely to get down to touching your toes within a couple of weeks. Um, Depends what your goals are. If you want to be able to bend over and either touch your toes or have a look at your own vulva, work on it. Work on those movement patterns that you need to do with either physio or anyone that you've got around you, and it will improve. And if you can't, and there's other health issues that's stopping you, get a mirror. Use
Yeah.
what's around you. Don't really force it into weird contorted positions that gives you pain. Work on that on the side, but get yourself some extra tools to be able to see what you need to see.
Yeah. The oh, just went in my head and straight out the other side there for a second. Um, it has completely
If you
gone out.
struggle with memory, get yourself a little notebook.
But then you can't think on your feet. Um, yes, all right. So basically, we can get it. We can get our movement back. It's not the end of
Yeah.
the earth, and that's probably one of the most important things. Is there anything else that we should cover while I try and remember what it was I was actually about to ask you?
I think for my advice for people either going into or in or even coming out of menopause is, I suppose, general advice for women is when you're getting help from healthcare professionals, be it physios, be it doctors, be it occupational therapists, take someone with you. Um, Take an advocate with you that can be there. Research suggests that having a man with you is better. I don't like having to say that, but it's true. Um, Outcome wise, it's better to have a man with you just to sit there in the background. And I've witnessed it with patients and with family members, just being sat there. How you're talked to is different. I don't like that it exists, but I can't be a physio and not acknowledge facts.
Can I
That's
actually just
better.
tell you something here? This will make your hair curl. Speaking of that, my husband's second language is English, so English is not his first language, and he does have certain health problems. So I decided one time that I would go along with him to see the specialist about this particular health problem, and just to make sure, because sometimes he'll come home and he'll say, "Oh, so and so said such and such," or he'll be reiterating something, and I'll think, no, that's absolutely not what they said at all. So it's a good idea to sometimes have a native English speaker in the room. So I went along, and this particular doctor, I will name the hospital, at Chelsea and Westminster Hospital, refused to acknowledge me in any way, shape, or form, did not answer any of my questions, and literally sat like this to me through the whole thing. So if we're talking about, I mean, thank God he wasn't treating women, because they wouldn't have had a really good time. I was shocked. Even my husband was shocked. We walked out after that and understood and said, wow, I don't think I have ever been treated so rudely by another human being. It was extraordinary. You don't want to be a woman.
No. And
No.
and I would love to say I've never heard anything like that before, but it's not true. Um, I hear it all the time, and I hate it. Um, and that's why I'm a big advocate for saying take someone with you, have someone else to be there to support you, not just to advocate for you, but also just for that support, that moral support, and help you remember what you want to say. It's terrifying, especially if during a consultation with whoever, um, you're being told that the symptoms that you've come in with is just depression, and we'll give you some medication for depression, which is lots of misdiagnoses, and especially early on, women come away with lots of depression medication, but that's not what you need treatment for. Um, Being able to reiterate the symptoms and to support you in terms of what you're asking for, because at the end of the day, from a physio point of view, you're my patient. I'm going to be treating you. If there's a reason why I'm not going to treat you a certain way, I will explain to you, and you have every right to say, well, I think this is the problem. Why aren't you treating that? That's when I say that to my patients. I say, this is what I think is going on. This is how I want to treat you. Do you have any questions? Do you have any comments? Do you agree? And if the answer is no to any of that, or yes, they've got questions, no, they don't agree, then we have that discussion. And that needs to be a discussion because I'm treating you. If I'm giving you exercise and giving you things to do with something you don't agree with, you're not going to do it.
No,
And we need to be on the same page as a healthcare professional and a patient. We need to be working together for your health. There's no point us having separate goals. So
no.
that for me is really, really important. And go in prepared. Um, when you go in, so I make a list and I will email people's GPs and say, look, I've gone through this list. We've gone through in-depth details in terms of symptoms. Um, I think it's menopause. Please, can you have a discussion? They want HRT. They want this discussion. They want a onward referral to gynecology. These are the issues. Please have a conversation.
And do they listen to you?
Yes.
Oh,
Um, I've not had any problems with any of my referrals, and the last couple of years, I've had no problems. Patients have got the treatment that they've been after, and things have progressed. I know that's not always the case, but coming at it from a physio's point of view, um, unfortunately, gives me an extra step on the rung, and I'm another healthcare professional. If the answer is no, I want a reason. I'll be questioning why not. What's your reasoning? What's the differential diagnosis? Why are you saying no to treatment? Why are you refusing treatment? And that's for everyone. And I will encourage anyone to question the treatment. If you don't like it, ask the questions or get a second opinion.
yeah. But I guess
If
also,
my treatment doesn't work, I want a second. I will ask my boss and my friends or a different clinic. I'll say, well, things aren't working. Can you see my patient? Can we see if we can have better outcomes or different outcomes?
yeah. The interesting thing out of that, though, of course, is that, to get a second opinion or to go outside of the NHS can sometimes cost an awful lot of money, which leads me to the question which I'd forgotten that I was about to ask you before is, are there any good free resources, any good apps that can help people with mobility issues, with strength training and things like that, that aren't stupid and sort of like shed body weight in 45 seconds by doing this? I mean, some actually good evidence-based things for improving mobility and stuff, like the Squeezy app for mobility. Do they have one of
The
them?
Squeezy app is good. There's an app called Bend, which is good for mobility. YouTube, YouTube yoga. I say YouTube beginners yoga. People that I want to get doing yoga that don't want to go to class, don't have the time or the money to go to a class. Beginners morning yoga. There's normally a couple of names that keep coming up on YouTube. I don't mind. Um, you don't need to waste your time with lose weight in however many sessions. Um, we're looking at movement. So I don't mind what you're using. Zumba classes. Lots of people have got gym classes or classes in town halls. Whatever you've got access to, it doesn't have to cost. You can spend extortionate amounts of money to do classes if you want. If you're a member of the gym, most gyms will have classes, or swimming. Absolutely fantastic for all the joints, especially backs. I forgot to say, but swimming for backs is really good. Um, and most gyms have got gym people that are there to support you. So if you've got questions or you want help on certain machines, they're fantastic. There's one down the road, so I'm in Glossop. There's a Glossop Leisure Centre, absolutely fantastic. People in there are incredible, lovely, really easy to talk to. Almost every gym has got them. Talk to the people that where you're trying to exercise. Talk to friends, talk to family. Most people will be able to give you suggestions where to go. There's lots of free stuff. There's loads of apps. There's a million different apps that you can get. There's always free versions. You don't have to be paying for them. There's not one perfect app that's going to do everything. For me, I care about the movement. I don't care how you're doing it. I don't care where you're doing it. I want just the movement and some strength. So getting some force through your bones, through your joints, to build up that strength with the hormone changes, especially with the risk of osteoporosis. I want the force and I want the flexibility. So any kind of stretching. If you find one day you're struggling to put your socks on, then that's kind of a wake up call saying, right, I need to start working on putting my socks on. And I quite like the happy baby pose in yoga. When you're lying on your back, you get your knees into your armpits and you're pulling your legs down. That's the similar position, as you when you're trying to
I can
bend
imagine
down.
what that looks like. So you're lying on your back, pull your knees up into your armpits, and
Yeah, if you Google happy baby,
yeah,
basically a newborn baby grabs hold of their toes and they can put the toes in their mouth. That's don't need to get your toes in your mouth, but that's the position, lying on your back to really work on some of that movement. And that's
I
the same
seriously
position if
don't
you're
want my
bending.
toes in my mouth.
But so yeah, really simple movements is what you need. You don't need anything fancy. You don't need to be paying out lots of money to get moving. There's loads of um, government supported schemes. So there's exercise on referral. So I'll do exercise on referral for probably 60% of my patients.
Oh, really? What's this?
Um,
I haven't heard about that. What's exercise on referral?
So exercise and referral, it's so I'm private physio, but there's exercise and referral. Normally GPs can refer you, but I can also so the local Tameside council has got a scheme. So it's different council got different schemes, but I can send off a referral to the scheme, and within 2 weeks, someone that's on the Live Active team in Tameside will give my patients a call, go through a quick history, take a medication history, take a quick um, diagnosis history, um, looking at risk basically for exercising. But I've done the referral, I've done the risk assessment, um, and they're just saying, well, what do you want to do? I'll already have sent what I want my patient to be doing, and they'll get in, having a little chat with their local gym. They have access to all the gyms around here, so you can go
Is
wherever
this
you want.
do they have this? Because I've never heard of this. Is it a
So
national?
it's based on the councils, I think. So my local council has it. Um, Lots of councils will have it. Um, GPs normally can refer, but most of the time, healthcare professionals in general just need to send a quick email to if you're seeing a physio or seeing an OT and just have a chat with them and see if there's a scheme in your area. Um, but yeah, lots of areas do have it. It's just finding it,
And it's free.
and it's either free or it's significantly reduced cost.
What a good idea. What a good idea. I love that. That's
There's also moving medicine. So it's a team I worked with in Oxford. They provide for both healthcare professionals in terms of how to help people get more active, but also for individuals what you can do, how you can turn normal life, everyday things into things to get active. So stuff like hoovering, mowing the lawn, looking at that. That's not just a chore, that's activity. So it's looking at your life and how you can build activity into it. So when I worked in Oxford and I worked with amputees and making the bed was exhausting. Um, so that counts as exercise. You're exhausted at the end of it. You're tired. You're fatigued. That's exercise. I don't see exercise as going running a marathon. That is some sort of exercise. But walking up and down the stairs a few times, that's exercise. Getting people moving isn't getting people into sport. It's different. Um, So anything you're doing when you're moving, and generally what I want from people is 10 to 20 minutes a day to start with of going doing something that you want to do for the purpose of exercise that gets you out of breath. At the end of that 10 or 20 minutes, if you're out of breath, that's what I'm going for. If you can still have a whole conversation, you think you can do it all over again, I want you working harder. And that's
I love
generally my physio
cool.
mindset. Yeah, cool. Um, and it will change depending on any other medications or medical conditions you've got going on. But there's nobody that I've said I want you to stop exercising and I want you to be on bed rest. I don't like bed rest. Some things you might need to reduce what you're doing or reduce how you're doing it, but you've got 4 limbs. 3 of those limbs or one of those limbs can be working. Get an exercise bike. If you can't stand up, get an exercise bike, put it on the floor and pedal. 40 quid from Amazon or £15 from Amazon, I think. Some of the cheaper ones. Stick on the floor, pedal, get your legs going, build up that strength. Stick on the table and do your arms. I don't mind how you're exercising. It's getting the body moving.
Yeah, absolutely. Well, I'm glad that there are sort of some low cost options there because it's at the moment, when we've got people pretty much living on food banks, it's in one of the world's richest countries, I will add, even though I'm Australian, although I have indefinite leave to remain. It's one of those things where you just kind of think, people need they need a hand. They shouldn't be excluded because they don't have the amount of money that they have, to afford a gym membership or whatever. This should be for everybody, and there need to be free options that everybody can access. Brilliant. All right, we've done an hour. There you go. Thank you for that. Where do people find you? Should they wish to find you?
I'm on Instagram. I don't know. You've got my Instagram. It's at pollen_physiotherapy. Or my full-time job clinic. I'm in Ashton-under-Lyne at the Chartered Physiotherapy Clinic. If you're up north, so I live in Glossop, but Ashton's just outside of Manchester.
Did you say at Pollen Physiotherapy or just physio?
I think it's just physio. Making me question it now.
I know. I'm just sticking on this.
Pollen_physiotherapy.
Ah, it is the whole word. Sorry.
Yeah.
Yeah. Sorted. There you go. That's on there. All right. Brilliant. Thank you so much for that. I will now end this on Instagram. Thank you, lovely people, for watching. And there we go. And I will also end it over here for everybody who's been watching on YouTube or anybody else. Thank you so much. And James, thank you. I can't tell you how excited I was to get your call after that, after the Menopause Research and Education Fund Day, and to find somebody who was actually interested in menopausal women and physiotherapy and muscle pain. So thank you again, and hopefully we shall speak again in the future.